Once they arrive into Egypt, they head into our dental clinic. The most important thing is the bone, of course. I use American implants. The first one kind about the implants. They also do their CT, their X-rays, and you can schedule the days just to do the implantation process and do any temporary prosthodontics, and then they can come later on after 3 months or 5 months according to their case. And then we can just plan for another 4 to 5 days maximum just to scan and get our final pieces. That's it. Once they arrive into Egypt, they head into our dental clinic, and I can just find clinically what's wrong and what do we need exactly, and we just discuss our case and our plans, and then we can just head into the X-ray center or the CT center. It's just 5 minutes away from the clinic, and it's fine. We will just handle this with each other. You just do the CT or the combine CT on the teeth that are requested, and then you can just do it on the same day or on the second day, exactly the implantation, and put something temporary, and you can free after 2 days or some to go wherever you would like it. So if it's about implantation, it would be much shorter time. It's fine, and then you can come back on after 3 months, 5 months, whatever. But we decide with each other, and then to take another few days for our final restorations. Immediate implantation, there is a tooth have to be extracted. So I asked the patient to do the CT part, the combine CT. So we can just study if I can just extract and do immediate implantation. Very few cases we can't do that if there is no enough bone for this. So we have to extract the end, put bone instead in the socket. So it takes its time until the bone augmentation happens. So we can after implant in that next vacation or something. But most of the cases, when there is a good bone and there is a space and everything, we can just extract and implant on the same day. This is the best plan. I always love this plan. If someone wants to extract, no, don't extract it. Please do the CT first. There is a chance for you just to extract and implant on the same day, and you finish this procedure as soon as you can. The most important thing is the bone, of course. We do the combine CT just to know the exact bone quality, quantity, length, width, and everything. So we can plan the implant very well. So that's the most important part. If you are a heavy smoker, also that won't be a challenge for us. We can just control this for a few days before and the day on the day of the implant and few days after. So just not to completely stop. Of course, I can't say this, but you can just make it 2-3 cigarettes per day for a few days before, like 2 days before the implant, on the day of the implant, 2 days after would be perfect just to control yourself into 2 or 3 cigarettes per day, so we can give enough time for the healing of the bone just to be perfect, and also for the gingiva just to be perfect and not to be inflamed at the time of the healing. Okay, of course. Also about the sugar level, the blood sugar level. We take the accumulated the blood sugar level. We want it to be around 7.5 maximum. We don't want it to be over this. Even if you have insulin or you have any other drugs, it's fine. But the most important thing that the blood sugar level is controlled. We want the cumulative number to be not exceeding the 7.5, so that we can be comfortable when we're doing our implants. Of course, you have to inform us if there is any other disease that you're taking any medication for, so we can just take care when we're just dealing with you. Everything else would be perfect and easy, and nothing challenges us. I can say that I use American implants, German implants, Korean implants. Actually, they are in the market, so they're considered the top. I usually prefer American because they are less cheaper than the German, and at the same time they have a great quality. Also, the German are really great, and the Korean is perfect. About the prices are less a little bit, but they have a good quality for this. Also, the Swiss, but they're very totally expensive. But actually, they're always available. If there's someone wants the Swiss, we're always there.
Get a great smile with dentification. Visit a hand-picked dental clinic today.